I'd like to invite Dr. K Misra, Senior Consultant Interventional Cardiologist at Sheikh Khalifa Medical Center in Abu Dhabi, United Arab Emirates, for the next 12 minutes to speak on coronary artery disease prevention, myths and facts.
Good morning, ladies and gentlemen. The first, I would like to give my sincere thanks to Dr. Satish Gupta and Dr. Chopra for inviting me on this spiritual land. What happened? So I am from Abu Dhabi, UAE, and just going to present something. What about some myths about CAD and its prevention? See, so before preparing this, I asked one of my patients, what do you think about the myth of coronary artery disease? So the first thing he answered, you people have created it as a huge thing. My grandfather is alive, he's 90, my father is alive, and everybody is fine. So a lot of people still do not believe. But what is the reality? Reality is it is number one killer. It kills nearly 700,000 people almost every year in the US. Half of them is getting acute myocardial infarction, some fresh, some recurrent. There's another myth. The lady said, maybe you guys as a man are worried, but as a woman, I'm not worried. I'm more safe and I do not have this problem. But what is the reality? The reality is 1 in 4 female also dying because of coronary artery disease. It is more than the malignancy. Even if you take on the spread, from 5 to 8% of all ladies in US are currently having a coronary artery disease. So it is not that it is not there in the woman. If you take all the age group, of course, in probably up to 40, 45, their incidence is slightly less than the incidence in male. But the moment they cross 60 or 70, the incidence is crossing the male. So there is a problem in coronary artery disease. There is another myth. People say this is a disease of 20th century, 21st century, because of we are eating burger, we are traveling in cars, we are not doing any exercise. What is the truth? What happened 5,000 to 7,000 years back? There is a famous study, which is known as a Horus study, and if you see the coronaries which has been examined for the mummies, about 44 mummies were examined out of 52, and what they found, if you see it carefully in this diagram of the CT, cardiac CT, you look at the RCA, full of atherosclerotic calcific patch. If you look at the LCA, full of atherosclerotic calcification. Aorta, iliac veins, renal artery, everywhere it is full of the calcification and the plaques. Other thing what they found, they compared these studies with the Egyptian currently living with 1 vessel, 2 vessel and 3 vessel disease. The only difference is the amount of the burden of the disease is much higher now than compared to in 5,000 years back. But it was prevalent, it was there. Another thing they also tried to find out, what happened to the royal families. They might not be as active as their preachers or the subordinates. So they examined the coronary arteries of the those who are inferior than the royals, and they found that the atherosclerotic was also therein relatively less than the royals. This all been published in Horus study. There's another study. So a lot of patients says or they say that my parents have a CAD. I am vulnerable, I will have CAD. So why to worry? What's the all use of prevention? In fact, after the currently finding out the genome of the human, there's a lot of study was going on genetic part of the coronary artery disease and hereditary part of the coronary artery disease. They have taken 200,000 of the families where is a complex clusters of the disease were existing and came out nearly for 1,000 genomes. Further analyzed and came out nearly 60 alleles. Doing all the meta-analysis related with the genetic disorder or as a genes, they came out probably there is a hereditary factor, but 28% overall. 72% is still acquired, which is not heritable. So heritable part, yes, it do exist, but amount is only 28%. So we have still a lot of we can do for the 72% part which is not heritable. One of the very famous myths these days everybody is getting in their WhatsApp, $1 billion cholesterol is come by the industries. What is the lipid theory? Is it wrong theory or is it correct theory? It has really any role to prevent CAD. At least 20 studies, which you can say CARE, Prove It, TIMI2, A to Z, Reversal, we have examined double-blind controlled trial, especially in secondary prophylaxis and prevention, has shown, categorically shown, that lipid did work, the lipid caused the problem and statin did work in reducing the LDL. There is a definite regression when the LDL was less than 70. And they have shown it that when it is done in experimental animal, it causes proliferation, macrophage formation, and there is a crystal formation. So in our plaque, if there is a crystal of cholesterol, crystallizes, cause the rupture of the plaque and cause the event. And once statin was given, it caused the dissolution of this cholesterol crystal. So there is a role, probably much more in secondary prophylaxis than in the primary prophylaxis. And this, especially to prevent an event, it has shown that it is regressing and causing the less events when the patients are on statin therapy. There is another myth, angioplasty. I have some chest pain. I went and did my angioplastic. I have stenting. I fixed my heart. I'm fine now. I have nothing to worry. There is no doubt. Angiography, angioplasty has a tremendous role, but in acute event. When the person comes with STMI, you take them as early as possible to the cath lab, do primary prevention and do primary PCI. And once you have salvaged the recirculation, you prevented the myocardium. Same goes with the non-STMI. But what about those patients who is a stable angina, who is having a negative troponin, who's having an atherosclerotic burden? Does angiography or stenting preventing it? The answer is no. There is no role of prevention by angioplasty. It definitely has a role in taking away with the symptoms of angina, taking care of the non-STMI or STMI, but it has no role for atherosclerotic. For that you have to do, stop smoking, exercise, control your weight, blood pressure and diabetes control. So that's the theory. Another myth, vitamin D. At least you must have seen hundreds of publications where they are shown that there is a definite relationship of atherosclerosis or coronary artery disease with vitamin D deficiency. Yes, indeed. They have shown about 30 to 40% cases of coronary artery disease have low vitamin D. They have published a lot of disease and shown that the lowest the vitamin D, the highest is the mortality, cardiovascular mortality. And the higher the vitamin D, they have a less mortality. They even shown myocardial infarction goes double when the vitamin D level goes down. Then everybody thought, okay, that's a very good thing. Let's give them the vitamin D and see what happens. A lot of a study came and the final was the record trial. And it shows supplementation of vitamin D is not regressing. It's not preventing myocardial infarction. It's not preventing from stroke. So there is something missing in between. It has an association, but it has no relationship when we supplement it, almost like multivitamin. There is a current vital trial is going on, already 2 years has passed. Probably in next 2 years the result will come and that will give the answer for the vitamin D. What about a lot of people say, oh, I'm walking almost every day. I walk in my office, I go from home to office. Walking isn't enough. It will not protect my life. Every physical activity is good. But here what we are talking about the protection for the event, from the event, protection from atherosclerosis. After doing a lot of study, the recommendation is minimum 30 minutes of moderate intensity, 5 days a week. And if you're doing less, say 25 minutes of vigorous, then include 2 days of stretching exercise. When you take this in terms of reducing your blood pressure or cholesterol, your exercise has to be higher. When they examined all this level of exercise in terms of MET, which you always do for checking the stress test, they found it out, higher the activity, much regression of the disease and prevention of the death. Lower the activity, less protection. So it is directly proportional to the amount of activity you do. There is another myth. I take multivitamin, vitamin C, vitamin E. Will it not protect? There's a lot of publication came, especially in 90s and to 95. 50 or 70 publication in almost every journal, from Circulation, from AHA, from AC. And what they have shown, even at one point there was a guideline came that the multivitamins is protecting. They found a relationship and they found that it is working and it is causing less coronary artery disease. They have even says the antioxidant has got a lot of role to play. This is all in 90 and 95s. Then meta-analysis came, and after meta-analysis, which is again published in the Lancet like a chaos study, and what they found that all this antioxidant supplementation probably has no role in preventing myocardial infarction, total death or cardiac death. And this verdict came from the AHA that it is good to take the diet which is rich in vitamins, the fruits which is rich in antioxidants, but there is no need of supplementation. So the recommendation for the diet which is abundant in antioxidant and the multivitamin, vitamin C is still recommended. Supplementation is not. And what are the foods which normally is recommended, which is rich in antioxidants, especially the vitamin? For example, if they say you want to take green leafy vegetables, legumes, nuts, papayas, seeds, whole grains, they are all good. They are best for vitamin E, which is antioxidants. Brown rice, oatmeal, soya beans, beta carotenes, which get from any red fruits, orange fruits, dark green fruits, vegetables, at least 5 to 10 servings. This is one of the best recommendation you can do to your diet. In conclusion, ladies and gentlemen, there are a lot of myths. Myths regarding a lot of activity. One of the myths which I haven't conferred here or taken like the myths in a lot of minds that yoga doesn't work, the meditation doesn't work. We have a lot of studies, that's why we omitted that part which proved, yes, meditation and yoga did work, that it is reducing your pain. So when it is myths, when it is confirmed in the lab or in the epidemic trial, it becomes a study part. When it is rejected, it remains the myth. Thank you.
Thank you, Dr. Misra. Please have your seat. We will come back to the discussion at the end of the last paper of this session that will be delivered on secondary prevention after coronary artery bypass graft.